Equip calculates a wide variety of quality measures, but today we're focusing on just two: statin use in persons with diabetes and statin use in persons with cardiovascular disease. Why are we dedicating an entire video to just these two measures? The answer is quite simple. The CDC reports that more than 34 million Americans have diabetes, and more than 28 million Americans have cardiovascular disease. We know that your pharmacy is caring for more patients with these conditions than ever before. We want to help you understand how these measures are calculated in Equip. Let's start with the statin use in persons with diabetes, or SUPD. The Pharmacy Quality Alliance, an independent measure developer with input from industry experts, established this method to measure statin use in diabetes patients. First, we look at the millions of people across the United States diagnosed with diabetes. We review which of your patients received 2 or more scripts for a diabetes medication, including insulin, during the measurement period. From that group, we include everyone between the ages of 40 to 75 and exclude any patients who have been diagnosed with end-stage renal disease. These patients become our denominator. Next, let's figure out our numerator by looking further at these patients. Did your patients on diabetes medication also fill at least 1 script for a statin drug during that same measurement period? If so, they are included in the numerator for your pharmacy. The numerator divided by the denominator shows us the percentage of diabetes patients that have a prescription for a statin. Our next measure once again looks at the patients across the country, but this time we're searching for those who have a heart condition. For this measure, we're looking at males aged 21 to 75 and women aged 40 to 75 who have filled at least 1 statin prescription during the measurement period. How do you identify these patients? We use medical claims data. Payers will report whether patients have undergone an event like a heart attack, bypass graft, or stent procedure. This number becomes the denominator for your pharmacy. So how do we find the numerator? First, we use our exclusion criteria to make sure those with the conditions listed here are taken out of the measurement. Next, we see who received at least 1 fill for a high or moderate intensity statin in the measurement period. The level of statin intensity for this measure matters, unlike our diabetes measurement, which included any strength of any statin medication. The numerator divided by our denominator shows us the percentage of patients being treated appropriately within recommended guidelines. Now that you understand how these measures are calculated, you can help provide the best care possible for your patients with diabetes and cardiovascular disease. In our next video, we'll describe how goals and benchmarks are determined in Equip to help you stay on top of your game.